what are the different options someone has when choosing a telehealth? Because we did have about 20% of the people that haven't started yet. So what are their options when choosing telehealth? What do they want to look for in a program?
Yeah, there's different buckets of types of programs out there. There's the really, I would call it like non-integrated, super lightweight tools that are just simply like a virtual visit. Then there's completely tightly integrated solutions that are out there. And then there's partner applications that like plug into EHRs or practice management systems. So really, every provider out there needs a PM, a practice management system, to do all of their scheduling. But the way that they can think about the virtual visits and the video visits, they can pick a lightweight solution, but then they're doing dual entry. So a lightweight solution might be, say, a Zoom, or I think we're on GoToMeeting, so it might be a GoToMeeting. It's completely independent of the PM, the practice management system, and the EHR. So there'll be a lot of dual entry happening. And again, this is something that I recommend all providers do, is look to make sure that it's a HIPAA compliant solution if you're seeing patients. So Zoom is out there. There's companies like DrChrono. We have an all-in-one solution. And what that means is you kind of get everything in a package, which there's pros to that, where you don't have to do dual entry and you can do things like prescribe drugs or order labs or, submit CPT, ICD code submissions to the insurance company. And then there's partner apps that layer on top of these PMs, which, they kind of build on APIs and then they push data back and forth. So I recommend that providers really take the time to figure out which solution would fit them best. Some of them are easier, some of them are harder. It's really what's going to work for them and what is their workflow. There's, specialty specific, even video visit apps out there. Like, I'll give you one example, VisitTrack. It's for physical therapists. It's a virtual visit app. It allows the physical therapist to administer videos. It allows them to do the video visit and have that conversation and then do a lot of interesting things on screen. So depending on your specialty, you're going to want to take the time. I wouldn't just jump into the first thing. I would for sure take time and process like the pros and cons of each and kind of think about the patient experience, because at the end of the day, you're going to be seeing a lot of patients with this product. You're going to want to really test out the product and the patient end of it as well to see how is the patient getting into it? How are they seeing that video visit? Is it easy? Is it hard? How much time does it take? Some providers are seeing 30 patients a day, 40 patients a day. Can that patient just simply hop on? Does it take time to register? What's that process there? So it really depends on the product.